Hello, welcome to the Memory Care Education Series. My name is Amy Hewes. I am a board-certified music therapist, and I am the intermissions coordinator at Green Spring Village. And I just want to thank Kara for having me on today to talk about using music across the continuum of care. Some goals of my presentation are that everyone leaves with a technique using music that is applicable to their work in memory care, and also to introduce everyone to music therapy who might not be familiar with it, and kind of explain the full scope of practice in memory care or long-term care. So the outline of the presentation, first I'll talk a little bit about music and the brain, then about what is music therapy. Then we'll go into how the best way to use music in programming in senior living and the pros and cons of each different type of programming. Also, some general tips of using music in caregiving, and also just some notes on general tips or guidelines on the use of music. So here we have a slide about the way the brain works. It looks like a puzzle, and you can see in the center here that music is right in the middle of the brain. Actually, depending on the musical task that you are doing, you might even be using multiple parts of the brain. So if you're singing a song, you're going to be tapping into memory, language, movement, vision if you're reading the words. If you are playing an instrument, you'll be using maybe some different areas of the brain, even more areas of the brain. So just to keep that in mind, the reason that music is so effective is that it uses so much of the brain, and in cases of dementia or other neurological conditions, the part that's damaged can be kind of bypassed by using music. All right. And music therapists take advantage of this neuroplasticity to overcome brain damage, and they can a lot of times be successful in rewiring the connections in the brain. Also, when the brain has been damaged in dementia, music can be effective in eliciting a response when speech alone might not be. And on that previous slide, there's a link to a video that just kind of talks about neuroplasticity and music. Oh, there it is. So if you would like to learn more about that, I would just encourage you to check out that video on your own. So next, I have a little introduction to music therapy. So this definition comes from the American Music Therapy Association. It says, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. So a very wordy definition, but basically it's goal-based, it's evidence-based, it's results-based, and it's something that people need to go to school for and complete a lot of clinical training to do. So some of the things that music therapy can address. Music therapy can be effective to manage stress, alleviate pain, express feelings, enhance memory, improve communication, promote physical rehabilitation, and promote wellness. So just looking at that list and thinking of the population that we work with here in senior living, I think all of those things are really important and really beneficial to our communities here. So it can be a great tool. Next, some things that music therapy is not. This is also from the American Music Therapy Association. So you'll see a lot of videos, at least I do, of a person with Alzheimer's listening to an iPod with headphones, listening to some favorite songs, which is wonderful, but it's not music therapy. Also groups such as bedside musicians, musicians on call, music practitioners, sound healers, and music thanatologists, celebrities performing at hospitals or schools, a piano player in the lobby of a hospital, nurses playing background music for patients, artists in residence, arts educators, a high school student playing guitar in a nursing home, or a choir singing on the pediatric floor of a hospital. So all those things have their place and can be beneficial, but just to kind of know the difference between the clinical use of music therapy and therapeutic music, which would be those things I just mentioned. Okay, so next I wanted to talk a little bit about the use of music in the programming of activities in continuing care and in independent living. So if you break them down, some of the categories might be entertainment, recorded music program such as music and memory, group ensembles such as choirs or chime ensembles, recreational music groups, which are more interactive but don't necessarily require any musical skill like an orchestra might. You might need some skill. They're more engaging and interactive. And this is often what you'll see music therapists providing in senior living, who it's pretty common to have a music therapist come in once or twice a month. So I would categorize those more as recreational music groups, unless they're doing the full scope of music therapy, which is the next section, which includes assessment, treatment planning, documentation, and evaluation. So also in group music therapy, you'll probably have a limit on your group size, and it's best for residents whose needs aren't met by routine programming. Okay, so we'll talk a little bit more about each of these different types of music programming. First up, for entertainment. It's the most common music program in senior living. I think we all can name a few favorite entertainers that we have coming into our communities. I would say to look for those gold star entertainers. Those are the entertainers that are really engaging with the audience, who are really great musicians, the people that residents really look forward to seeing. Here at Green Spring, we have Dale Jarrett, who is extremely popular, and people really look forward to his concerts. And I think he does a great job of listening to the audience and engaging with them. So I would say the best case use for entertainment is to get those gold star entertainers and definitely use them for special occasions, as much as you use them as often as you can, but really try to use your money the best way to get the best entertainers, because they can be expensive. Some other considerations about entertainment is if that's the only thing that you're offering, it's not necessarily very person-centered, because not everyone is really able to engage in that type of programming, because it can be pretty passive. So the next type of music programming I wanted to discuss is recorded music programs, which are becoming very popular as technology develops. So a popular one is music and memory. I know if anybody has seen the viral video of Henry listening to an iPod, that's the program that he was using, music and memory, which is a personalized music listening program where people are assessed for their favorite type of music and are given an iPod just with their preferred music, which is wonderful. I think it really expands access to music, especially for people who might not have their record collection or their CDs that they had in other living situations. Some disadvantages is that it can be a passive experience. It can be isolating, especially if there's not a staff or volunteer or somebody there to really interact with the person as they're listening to the music. Also, it's easy to get the equipment and have the training, but it is a big hurdle to keep the momentum going. You'll need a lot of motivated people and a lot of time to implement the program. And music is more complex than it may seem. So the best case use for recorded music programs is to build your recorded music library, get internet access and devices that your staff can easily use, and make the investment in the program so that it's successful. All right. The next type of music programming is group ensembles. Examples of these are choirs, bands, folk music groups, chime choirs, all those kinds of things. These are great because they provide purposeful and meaningful engagement, as well as a creative outlet for residents. Something to consider is that they do require a group leader with musical expertise and some investment required for purchasing sheet music and equipment, that kind of thing. So the best case use for this is to find a skilled and flexible musician and leader for the group, and to also care plan for it. The benefit of doing that is it makes it a priority, and you can also communicate with care staff about the residents' experience and how beneficial and meaningful it has been to them, and thank them for making it happen. Just as a side note, performance-based music therapy is kind of an emerging thing in the music therapy world, and there are applications in senior living such as Parkinson's choirs or chime ensembles. So Parkinson's choir would be a very thoughtfully designed choir that works on some of the things to increase vocal production and volume. Chime ensembles can be great in a lot of different areas, but it's also wonderful for people who don't have a lot of musical expertise because they can just follow the conductor with that. And for people who have memory issues, it can be very successful for them. All right, the next type of music programming is recreational music groups. These are more engaging and interactive than entertainment programs. They might include movement to music, playing instruments, group singing, and songwriting, and other things too. As I mentioned, this is often what contract music therapists do for a monthly group in senior living. And I think they're great. I think all of these are great, and we should be using all of them. But some of the disadvantages of this type of programming is that it can be expensive. A lot of times in these groups you'll have a huge group size, like 20 plus people, and that's not going to meet the needs of residents with high needs due to that group size. So something to be mindful of. The next type of music programming is music therapy, group music therapy. So this would follow the standards of practice with assessment, treatment planning, documentation, and evaluation. So it's definitely a more involved and intentional approach, and it's really, when it follows all of those steps, you can really see the benefit of this programming. It's best for residents whose needs aren't met by routine programming. So Some groups that I have done have been very sensory based, so a very small group size, maybe 2 or 3 or 4 people with high needs, but what you're able to do in group music therapy is bring those people together, engage them all in a musical experience, give them that one-on-one attention that they need to be successful, and a lot of times that is one of the only times you'll see these people engaging socially, so it can be very effective. Some disadvantages or things to watch out for is that not all music therapists are created equally, so you want to make sure you get a really good one. It can be expensive, and smaller group sizes are required for those clinical services. Okay, so now that we've talked about using music in programming activities in senior living, I wanted to talk a little bit about using music in day-to-day caregiving tasks. And these are things that can be done by anybody who works directly with residents. Could be a nursing assistant, an RN, could be a chaplain, it could be somebody who works in the dining room. These are tricks I think anybody could use. So one thing that music can do is to create or build rapport with a resident. And I think this is because music communicates caring. So when you are singing to somebody, it's kind of can be a vulnerable thing. So it communicates that you're a safe person, and it's dignified to talk about music. When you're talking with someone about their favorite music, you're getting to know them as a person. So these are some of the reasons to use music. So one way to create or build rapport with a resident is to ask them about their favorite music. Sometimes that can be too much for someone. Another trick you could try is say, "Hey Joe, I've had this song stuck in my head," and then start singing a song you'll think he'll know, and ask him if he knows it. A lot of times Joe will end up singing along with you, and that instantly creates a relationship that maybe wasn't there before. Another way to use music in caregiving, it provides familiarity and comfort in potentially stressful times of day. So you can use music during those times of day. Try humming a gentle tune during the shower if that's a stressful time for somebody. And I would recommend starting before that usual stress occurs. So maybe even on the way to back to the person's room or bathroom to the shower, just start humming that tune, and you can mix in the conversation and the song, and create a nice experience out of it. And that will also, again, communicate that you're a safe person, and it can also support that routine. If you're always humming when you do the shower, then the person will learn that that routine and those cues. Okay, next tip is to use stimulative music to boost energy. So at those times of day where you're looking for more energy, maybe before a meal or before an exercise program, upbeat, familiar music can help people feel more energized. Utilized before a meal, it can also increase food intake, and it can help support movement or exercise. So all great reasons to use music. On the opposite side, when you're trying to facilitate relaxation, try using sedative music. So that means something with a slower tempo, something that doesn't have a lot of changes in volume. And just something to watch out for in that, a lot of people automatically think that classical music is relaxing. So it certainly can be, but just watch out for those big changes in volume, because that can turn the sedative music to stimulative pretty quickly. So try singing or playing something sedative when you are trying to create that relaxation. Next, you can use music to establish a routine. So maybe 15 or half an hour before a meal, you could try playing piano music in the dining room. So once it gets established, that can be a fabulous cue for people to know that it's going to be mealtime soon. People will also automatically just come into the dining room to see what's going on. I think even better would be to have live music if it's possible, and that could be a great opportunity for a volunteer or a staff who knows how to play the piano, just to use it before the meal. I would say during the meal, it kind of depends on the residents you're working with. I would opt for something a little more sedative, just so it doesn't get in the way of conversation or important cueing that needs to happen. All right. So music is a non-pharmaceutical intervention that can and should be included on care plans. And so with this, I just wanted to note, if you're using music in caregiving and it's working, I would encourage you to include it on the resident's care plan and share that with the rest of the care team, so that everybody can have more success in caring for our residents. So you might say on the care plan, before the shower, sing this song to the resident, or if the person is feeling anxious, try playing this playlist on the iPod, and that will also should result in some documentation to see if it's working and helping. And I also just wanted to make a plug for including a music therapist on staff, because a music therapist not only can provide programming and guidance on music and programming, all the things we talked about, entertainment, group ensembles, that kind of thing, but they can also provide clinical music therapy, and they can advise and train care staff on using these caregiving techniques. And they're ideally utilized as part of the interdisciplinary team. Next, I have just some general tips on the use of music in senior living. It's important to use individualized music, and when I say that, I mean what the resident prefers. That is the best thing to use. Sometimes it's hard to know when someone's not able to communicate very well. So one suggestion is to include this, some kind of music assessment when people are coming into higher levels of care. I think it would be fabulous to have it as people come into independent living, but maybe we'll get there one day. And that way, you really know what to use. If you're not able to communicate directly with the resident and ask them, if you're able to ask family, that's great. The next best thing is to work with the resident's age and kind of shoot for their teens, 20s, and maybe even a little bit before, because those are the songs that were around during the person's formative years, and they'll likely remember those. My next tip is that music is not always safe. So intense negative reactions can and do occur with the use of music. So it's just important that people know this and monitor responses to music interventions. But also there is such a thing as too much music. So music that is too long in duration or too repetitive can cause fatigue, and residents need quiet time as well. We all do. Next, environmental noise is a big issue. So I would say in common spaces, I wouldn't have background music necessarily all the time. I would opt for more ambient sounds like a fish tank or an open window with sounds of nature, versus having competing conversations going on, TVs playing loudly. Basically just try to be aware of the acoustic environment. If you're having a music program, definitely turn the TVs off, try to keep the conversations to a minimum. And when you're trying to have a group program that's not music, maybe turn the music off. My last tip is for residents who aren't able to communicate their needs very well, to avoid playing the radio for them, just because of the advertisements. I would definitely opt for CD players or music streaming when you know that they're not going to have commercials coming up. A lot of times people aren't able to turn the volume up or down themselves, so you don't want to kind of put them in a situation where they would be have that really loud ad coming on. So just another thing to be aware of. All right, so I think that brings me to the end of the presentation here. I am happy to answer questions if you have any. You can reach me at the email address on the screen. It's amy.hewes@erickson.com. Thanks so much.